Hello everyone, this is Dany Mohsen and here's a new podcast about an exciting subject as usual. Today we're gonna discuss rare diseases. Rare diseases is little bit well known among people. That's why I'm hosting today on my right Dr. Ayman El Hattab, who is a consultant clinical genetics and professor at College of Medicine in the University of Sharjah. And on my left I have Sahar Abdelaziz, who is a geneticist at First Genomix lab. Welcome Dr. Ayman and thank you for sparing the time to be with us today.
Thank you very much.
Welcome Sahar.
Thank you for hosting us.
Thank you very much. Okay, we're going to start our podcast. Stay tuned for much more information. Dr. Ayman Al Hattab, I'll start with you. When I say rare diseases, what is the definition of a rare disease? How do you define a rare disease?
Okay, thank you, Dany. Now, we have more than 300 definitions for rare diseases. Some of them depend on prevalence. Some of them depends on total number of affected individuals in certain regions. But I think the most accepted and widely used definition is the definition made by Rare Disease International, the RDI, and the WHO in 2019, and defines rare diseases as diseases with incidence of less than 1 in 2,000. So any disease has prevalence of less than 1 in 2,000 is considered a rare condition.
Okay. Tab, if I ask you, what is the prevalence of impacted people with rare diseases?
Like, it has been estimated that we have more than 400 million individuals with rare diseases globally, which is at least 5% of population affected with rare diseases. Like, yes, individually they are rare, but because we have many rare diseases, latest estimate is more than 10,000 rare diseases. So if you put them all together, they affect more than 5% of people.
Sahar, I'll come back to you. Are all rare diseases considered to be genetic?
Actually, no. Not all the rare diseases are considered of genetic origin, but it's estimated that up to 80% of them are of genetic origin or genetic nature. Of these genetic disorders, there are we call them single gene disorders, where the phenotype or the condition is caused by alteration in the gene only, nothing else. Like, this is the only factor affecting. But also we have the multifactorial conditions where genetic component is one factor of many, but you still have other factors such as the environment, like infection. But in total, yes, 80% of rare diseases are considered or estimated to be of genetic nature.
Thank you, Sahar. I'll go back to you, Dr. Ayman. If we speak in figures, are the impacted people in our region, like the Middle East, the number of impacted people, is it similar to US, Europe? How do you compare it with Europe and US, for example?
Okay, thank you. So, no, we have more people with rare diseases than any other place, because as Sahar mentioned, most of these conditions are genetic in origin, and these can be inherited in different ways. Particularly autosomal recessive conditions are we have them at higher prevalence in our region, because these conditions.
Why? Yes.
Thank you. Because these conditions increase with a high consanguineous marriage, which is high in our region. So because of the higher rate of consanguinity, we have higher rate of recessive diseases, which constitute a large portion of rare diseases in our region.
So in our region, we have much more due to interfamily marriages, as you're saying.
Absolutely.
Right? Okay. But why is it hard to diagnose a rare disease?
So we have many factors. So the first point you started the podcast with is we have limited knowledge about these conditions, limited knowledge among physicians. So it's hard for doctors to diagnose these conditions, and many times patients have to visit multiple specialties before they reach the diagnosis. Second thing, we go back to the point that the cause of these conditions are mostly genetic. So you need genetic tests to be done to confirm the diagnosis, and sometimes these tests are not every lab can do these tests. You need really specialized labs to perform this testing. And the third point maybe is the limited knowledge among even public. People know little about these conditions, so to seek medical advice for these conditions is less than to seek medical advice for common diseases, and this is what you are currently trying to do by raising awareness about these conditions, so we know more about these conditions and we diagnose more of them.
I'll go back to you, Sahar. Currently, can newborn diagnosis or screening diagnose rare diseases?
Yes, actually it can. So the newborn screening programs worldwide can help diagnose or find the early diagnosis of a newborn disease or genetic rare disease. But the problem is we have a very limited list of genetic diseases that are screened through the different programs. We're talking about cystic fibrosis, beta thalassemia, sickle cell anemia, and some metabolic disorders. But if you compare this to the huge list of rare genetic diseases, still we are missing a lot. There are studies suggesting to expand the gene panel, like the newborn screening, to be based on a gene panel like NGS sequencing for rare diseases or genetic rare diseases. But I think Dr. Ayman would agree also that it's very complicated when you set the criteria, what will be included, what will be excluded, and also the criteria of reporting, what to be reported. So it's a debate, and we don't have this right now. But since we are thinking of the future and we're talking about healthier generation, we are also encouraging couples to go for carrier screening, expanded carrier screening, where we include more than 3,000 genetic disorders or genetic conditions. By doing the test, the couple can know actually and can estimate the risk for affected offspring. They have a high risk or not. So in our lab, we are working on the newborn screening, but at the same time, what is currently available is the carrier screening, the expanded carrier screening
even
test.
Before newborn.
Exactly. It's
Before
you're trying
conceiving.
to catch. Yes, you are trying to catch the problem before it happened. Yes.
Okay. Dr. Ayman, do you think newborn screening should be extended to more rare diseases, to cover more rare diseases?
Yes, I completely agree with Sahar that yes, we need to include more conditions, and in the future, most likely people will be, because currently newborn screening is mainly based on biochemical markers, and in the future, it will go to like more of molecular testing, where we test for mutations to diagnose the diseases to be included in the newborn screening.
Sahar, what is the importance of genetic testing for people having rare diseases?
Genetic testing for individuals with rare disease is very important. It's a game changer, actually. We are trying to diagnose. This is the first part. We are trying to find the diagnosis, the underlying cause. If the genetic disease, which actually can significantly help in finding the underlying cause, the physicians can predict the prognosis. This can increase the chances of treatment and care management for these individuals. Additionally, for the families of those affected individuals, the genetic test can help them assess their own risk for this condition.
What if I ask you about the most advanced genetic testing currently? What is it, and does it cover all rare diseases?
Okay, so to answer the first part, we consider the most advanced genetic testing now is the NGS technology, next generation sequencing, including whole exome and whole genome. So these two approaches, they can analyze the whole protein coding region, which is the whole exome sequencing, or the entire genome, including coding and non-coding regions, which is the whole genome sequencing. NGS, or as other technologies, it's still evolving. But to answer the other part of your question,
if it covers all the rare diseases.
We are aiming to have one test that can solve everything and can cover all, but currently still there are diseases that will not be covered under the NGS or the whole exome, whole genome. And here the physician, the consultation with a clinical geneticist is very important, because they can actually examine the patient, reach differential diagnosis, and they can select the right test. And instead of patient going through different tests until they reach the accurate diagnosis, I think it's a crucial part of the diagnosis is to be seen or examined by a clinical geneticist.
Okay, so if I want you to name for me the test, just for our viewers to understand which test is that, what is the name of the test?
The test we're talking about is whole exome sequencing and whole
exome
genome sequencing. Yes.
Okay,
These are the two tests I
Two
talk
tests.
about them.
Okay.
Yeah.
Right. Dr. Ayman, when do you think a physician should recommend whole exome sequencing, for example, for his patient? In which cases?
Yes, now we have clear recommendations from the American College of Medical Genetics published in July 2021, like 3 years ago. They recommend doing whole exome or whole genome sequencing for children with developmental delay or cognitive impairment, and also for children with congenital anomalies. So these are the current recommendations. If we have a child with delay, the child didn't like walk on time, didn't talk on time, or cognitive impairment, learning difficulties, all these children should have a exome sequencing, because as Sahar mentioned, this is one test for all the genes, the known genes, understanding that, of course, the limitations. Same thing for congenital anomalies. If we have congenital anomalies, also we need to look for the reason for these congenital anomalies. That can be a defect in one of the genes, and exome or genome sequencing are exome and genome sequencing are really the recommended test in these two scenarios.
Since we are talking about these tests, whole exome sequencing or whole genome sequencing, could you tell us, Sahar, how are they performed?
Yeah, sure. So basically, after the physician will order the test for the patient, a blood sample will be collected from the patient and sent to the genetic lab, where the genetic material, the DNA, will be isolated from the sample and will be sequenced through the NGS, next generation sequencing technology, and then will be analyzed. So the analysis part is the most important. Of course, the sequencing is important, but the most important part is the analysis, the reading of the result. Here I want to highlight a very important part for physicians when they are requesting whole exome sequencing or whole genome sequencing test for their patients. We have access, by doing this test, we have access to thousands of genes, thousands of variations, and we need to reach the genotype phenotype correlation. The amount of information given from the physician to the genetic lab or included during the test order is very important. It will help write the clear diagnosis in shorter time and to minimize the VUS, like variant of uncertain significance detection. It will minimize significantly if we get the accurate information about the patient's symptoms, the age of onset, like if there is family history. There are data or information that are required from the physician that we emphasize, and we are asking all the physicians to write them into details when they send them to for genetic testing for whole exome or whole genome sequencing.
Okay. Aside from diagnosis, can genetic testing help in other aspects like treatment, for example?
We mentioned actually that genetic testing can help diagnose a rare genetic disease. And we mentioned that it can be utilized for couples conceiving or planning for conception by testing the risk or evaluating the risk for having an affected child. This test, we call it carrier screening, and it's a very important test. We are actually trying to raise awareness for this test for any couple planning for marriage or planning for conception or
Tell me more
kids.
about it. Like, the name is very appealing.
Yeah.
Carrier screening.
So carrier actually means you're just a carrier, you're just a silent carrier, you don't have symptoms, but in your genes, you have the disease. You carry it in a silent way, silent state. And if we have two partners, both of them are silent, of course they will not know that they are carriers because you won't manifest the symptoms. But if we have two carrier partners planning for having children, they have around 25% risk to have an affected child with the disease. Mm-hmm. The baby would receive the abnormal copy from each parent and hence will be affected. So in this test, we include recessive conditions. We call them autosomal recessive or X-linked recessive because there is also the X-linked recessive coming from female to her male offspring. So in this test, the carrier screening test, In our lab, there are different type of carrier screening, but in our lab, we are doing it through whole exome sequencing. We are including the most comprehensive list of genes for autosomal recessive and X-linked recessive genes. And if we have positive result from the test, if we have risk for that couple to have an affected child, increased risk to have an affected child, genetic testing still can help prevent this or exclude the risk. And this will be through the IVF, the in vitro fertilization procedure. They can test the embryos before they are transferred to the uterus and make sure that the embryo is not affected with the disease. Additionally, in addition to the diagnosis and the screening programs, there are some conditions such as sickle cell anemia, beta thalassemia, or immunodeficiency where bone marrow transplant or stem cell transplant can cure the patient. But the limitation here is finding a compatible donor. Through the IVF and genetic testing, we can help the couples find an embryo that is HLA matching with their affected offspring, which consequently can help in the treatment, the cure or the treatment.
Excellent. طيب, Dr. Ayman, can you tell us about the latest breakthroughs that can benefit the people having rare diseases in genetic research, I mean?
Yes. Now we have many research related to finding treatments for rare diseases. We have now more and more of gene therapy for more conditions. Like now we have gene therapy for spinal muscular atrophy. We have a new gene therapy now for Duchenne muscular atrophy. So we're having, and the list will get longer and longer now with the advancements and getting more treatments. Not only gene therapy, but also we start seeing like a lot of other medications that can modulate the functions of the defective genes, and these will help patients. So I think in the near future we will have more of the rare disease that can be treated. Now the estimate is maybe 5% of rare diseases that have like curative treatment, but with the advancement we will have more and more diseases that can be cured.
I would like to hear about success story, where the diagnosis was done perfectly and there was a treatment. Do you have something in mind to tell us?
Yes. We always, like every year, maybe I get like 2 or 3 very successful stories. And I think the one that comes to my mind now, a family with 2 affected children. They were teenagers. They have severe seizures and developmental delay, and their seizures were difficult to control. And when we did the exome sequencing, we diagnosed a very rare condition called cerebral folate deficiency. Now, yes, we reached a diagnosis. We know what's the diagnosis, but also this diagnosis enabled us to choose the right treatment. And when these siblings were started in the right treatment, the seizure improved a lot, and their neurological condition also improved. So we always have like these. We always see like these specific conditions where you have a specific treatment, and initiating that specific treatment can help in providing the right care, and will help in improving the condition of these affected individuals.
People. These awareness efforts, how do you feel that they can support the rare disease community?
Yes, as we started the podcast, right, we said we have limited knowledge. So if we start with limited knowledge among physicians, definitely, yes, we need to raise awareness about rare diseases among physicians to enable them to diagnose these conditions faster and provide the appropriate treatment. And this can be done by doing conferences, meetings, lectures. But at the same time, we need to raise the awareness among public. To know about these conditions and when to seek medical advice. We need to raise awareness among insurance companies, because like we have issues with insurance coverage for rare diseases. Now, if you, and this has been studied, like the same publication that I mentioned, the recommendations in 2021 for the American College of Medical Genetics, they looked at the cost of exome sequencing. So if you do the exome sequencing, you reach the diagnosis faster and at lower lower cost. However, if you didn't do the exome and you start doing like multiple tests, the cost will be much higher, and then you add the exome at the end, the cost will be even higher. So if you start with the exome sequencing, this is why like the exome sequencing now is recommended to be the first test before you waste your resources on different tests. If you start with the exome as first test, then actually you will save money, and this is what we try to convince. Yes, money and time. Thank you. So and this what we try to convince insurance that you cover this test, it will save you money on the long run. We also need to raise awareness among stakeholders and decision makers, again to establish more policies to enable easier access, medical access and support for people with rare diseases. Now, part of raising the awareness, we have an annual meeting for rare diseases, the MENA Congress for Rare Diseases. The third meeting will be in May 2024. This will be like the largest event for rare diseases in the region, lasting for 4 days.
Where is it taking place?
In Abu Dhabi, from May 16 to May 19. We will have more than 140 speakers coming from more than 20 different countries and discussing variable aspects of rare diseases, from diagnosis to treatment to research to latest advancement to challenges. So this effort we have been doing again to increase awareness among healthcare providers, publics, researchers, patients and their families. So we hope that during this opportunity we'll be able to provide the most updated knowledge, enable people to communicate and interact and exchange experience, establish network, establish collaborations, at the end aiming to improve the knowledge and provide better care for these individuals.
Okay, so we invite everybody interested about the rare disease subject to attend this event. When is it going to be again? In May 16th, you said?
Yes, in May 16 to 19, 2024. And people can know more and register through visiting the website, menararediseases.com.
Okay. Excellent. Now you know the website. You can visit it and register. A final advice from you, Dr. Hattab, for the community of rare diseases.
Yes, the final advice is for parents. Now you know your child more. So if you are concerned about your child, that your child didn't talk on time or didn't walk as expected, do not wait. The first step is to take your child for a clinical assessment, and part of this assessment will be a genetic evaluation and genetic testing. This is very important because early diagnosis will help in starting treatment early and have a better outcome.
So screening early is the solution. Early screening.
Yes, if you have any concerns, then yes, you need to seek medical advice and start with the journey of evaluation and testing.
Thank you very much. A final advice from you, Sahar, for the community of rare disease.
Yes, I think Dr. Ayman covered the message to parents who their children is still not diagnosed, right? They have a rare disease but it's still not diagnosed. So I would like to target the parents whose children are already diagnosed with a rare disease.
Okay.
So basically, we need them to connect, to build a support group among each other. We want them to educate themselves about the ongoing trials and the ongoing research. Dr. Ayman mentioned that we have now cure or treatment for spinal muscular atrophy and Duchenne muscular dystrophy, which used to be just a dream. But with science, dreams come true. So never lose hope. Everything is dedicated for the treatment and the research to find the solution. You just need to be on top of everything. Reach out. You can attend conferences like what Dr. Hattab mentioned. Just keep fighting, and we are all together in this. And again, with science, all dreams can come true.
Excellent. And if people want to come for the genetic testing, you are there in Dubai Healthcare City, right? First Genomix?
Yes, for genetic testing, we have all the tests that we discussed now, and of course and other tests, are included in our testing menu, and we are in Dubai Healthcare City, Dubai.
Excellent. Thank you very much for both of you, Dr. Ayman El Hattab, Sahar Abdelaziz. Thank you for sparing the time to be with us and to inform us more about rare diseases. I hope you enjoyed this podcast. Stay tuned for new podcasts and new subjects. Thank you very much for your time.